The integral and critical component of health is mental health. The WHO Constitution says, health is a complete health, and not just an absence of diseases or infirmities. It is as an important implication that the absence of mental disorders or disabilities is more than mental health. Mental health is a state of well-being in which someone realizes his or her own skills, is able to cope with life's normal stresses, is productive and can contribute to his or her community. Our ability to think, emotion, interact, live, and enjoy lives is based on mental health, both collectively and individually. On this basis, it can be considered as a vital concern for people, communities and societies all over the world to promote, protect and restore mental health. The level of a person's mental health at any stage is determined by various social, psychological and biological factors. For example, violence is recognized as a mental health risk and continuing socioeconomic pressure. Sexual violence is the clearest evidence. Poor mental health is also associated with rapid social change, stressful working conditions, discrimination against women, social exclusion, ill health and violations of human rights. Psychological and personal factors are specific that make people more susceptible to problems of mental health. Genetic factors are part of biological risks. Mental diseases are more prevalent than cancer, diabetes or cardiac disease. More than 26% of all Americans aged 18 and over meet the mental illness criteria. A WHO report estimates the total costs of mental illness to be nearly $2.5 trillion in 2010, with a projected rise of more than $6 trillion by 2030. WHO evidence suggests that almost half the world's population has a mental illness that influences their self-esteem, relationships and the ability to work in daily life. Emotional health can affect the health of a person. Poor mental health can lead to problems such as decision-making and drug abuse. Good mental health can improve the quality of life, while poor mental health can make life worse. The evidence that emotional ability is linked to pro-social behavior such as stress management and physical health has increased, says Richards, Campagna, and Museberg. Their research has also found that persons lacking emotional expression tend to be antithetically motivated, for example medicinal products and alcohol abuse, physical fighting, vandalism, which reflect mental healing. Patients and families are guided through the fragmented, often confusing mental health industries by navigation through mental health care. Care navigators work closely with patients and families through discussion and collaboration to inform practitioners and facilities specializing in specific forms of emotional improvement on best treatments as well as referral information. The difference from therapy to care navigation is that patients are provided with information through the care navigation process and directed to treatment instead of to treatment. Navigators can still offer diagnosis and planning of treatment. Many care surfers, though, are trained doctors and therapists. The link between the patient and the following therapies is care navigation. A study by Kessler et al. Of the prevalence and treatment of mental disorders from 1990 to 2003 in the United States has demonstrated a clear acknowledgement that mental health requires medical intervention. Although mental health disorders are unchanged throughout the period, there has been a threefold increase in the number of patients seeking treatment for mental illness. No matter how long the explanation last, we cannot express the importance of our mental health, waiting for us in the mental health series. Goodbye.